Okay. Good afternoon, everyone. We'll start session at 3:05. We'll wait for a few participants to join. Thank you.
Okay.
All right. We have quite a good number now. Good afternoon, everyone. Myself, Kunal Singla, work as Communication Officer at CHIP Foundation. It is my pleasure to welcome you today session on demystifying the tobacco industry's portrayal of e-cigarettes as harm reduction tool, an issue that has become increasingly important in public health. As e-cigarette use continues to rise, particularly among younger people, we face significant challenges in understanding its long-term effects and potential risks to both individuals and communities. Today, we are fortunate to have an expert that will help shed light on this critical topic. Our discussion will cover the health implication of vaping, including concern around addiction, lung damage, and cardiovascular risks. We will also explore the regulatory landscape and what measures can be taken to reduce the health burden associated with e cigarette use. I hope you find the session insightful and that together we can take steps towards ensuring the safety and well being of our communities. Your participation is vital as we work together to understand the risk of e cigarette and find solutions to protect public health. I look forward to an insightful conversation. Thank you. Over to you, Dr. Shekhar. Hello.
Hi, good afternoon. Thank you, Kunal. Uh, Good afternoon, everyone. I do sometimes get glitches when I open up my video, so I'm sorry. This session is going to be me without any video on. And yes, I can see our guest speaker for today, the star of the show, Dr. Ravi Kaushik. Hi, Dr. Ravi. Good afternoon.
Good afternoon.
Yeah, let me give a formal welcome to you. Uh, well, uh, it is a pleasure, to be here with him, Dr. Ravi Kaushik. Dr. Ravi Kaushik is a professor of physiology at Maulana Azad Medical College and Associated Hospitals, New Delhi. He holds MBBS and MD from UCMS Delhi University, India, and PG Diploma in Geriatric Medicine, as well as an executive program in management from Wharton Business School, USA. Dr. Ravi is a NIHR UK Fellow and is also associated with PGI Chandigarh as a resource faculty in School of Public Health. He has worked with ICMR, National Institute of Cancer Prevention and Research, as well as in the WHO FCTC Global Knowledge Hub on smokeless tobacco. Dr. Ravi has been involved in various governmental programs like the Nasha Mukti Abhiyan, which is the Drug Control and De-Addiction Initiative Task Force, and a global project, ASTRA, which stands for Addressing Smokeless Tobacco and Building Research Capacity in Southeast Asia. He has over 16 years of experience in medicine, teaching, research, and management. So here we are, and let's welcome him and let's hear from him on this very important topic regarding how industry portrays e-cigarettes as a harm reduction tool. So welcome, Dr. Ravi, for on this platform.
Thank you so much, Dr. Shekhar. It's a privilege to be with you all. Thank you.
So, Dr. Ravi, I'll give you a brief introduction about the participants as well. We are, all of us are a very mixed crowd. Many of us are young researchers, and some of us are medical professionals, public healthcare professionals, and as well as budding researchers. And many of us are involved in various organizations, including NGOs, government and non-governmental, as well as the private bodies as well. So we would like to hear from you regarding some opening remarks, what you have to say about the tobacco industry and the e-cigarette industry.
Right. So thank you again. Thank you so much for the opportunity being given to address. Uh, I would say a very potentially promising people, and being from public health background, I'm sure all the people here are pretty much knowledgeable about the tobacco industry interface, and the what government is basically doing, especially with regards to e-cigarettes. What we are going to here discussing is basically how the first question, as I can collect from what you have told us. The first point is how the tobacco industry is portraying this as harm reduction. So it is more of a narrative which is definitely given lately by tobacco industry, and to some extent, I would say they are not wrong factfully. However, the point here from public health perspective is that the e-cigarette or tobacco as such, there are several aspects, key aspects, which are important with respect to the nicotine, high dose of nicotine, which is being imparted or being given through e-cigarettes. So what industry funded research, there are two type of researches which are there. Industry funded researches, therein you can definitely see that there are lower levels of toxins or lower levels of aerosols which are there in e-cigarettes compared to traditional cigarettes. This might be true with respect to the tar which is there in the normal cigarettes. However, the public health research which are not industry driven, they definitely shows that e-cigarette still pose a significant health risk, especially the cardiovascular risk along with the pulmonary diseases. Now, influencing what tobacco industry is also doing is through this scientific rigor or scientific articles which they are publishing. Through that, they are trying to impact the scientific and regulatory, the debates as well as regulatory authorities. They are also targeting the youth and the new consumers, and that is something which is definitely potentially very, very harmful. Why so? Because e-cigarettes come with low amount of smoke as such. The e-cigarettes are pretty frequently used in school settings, also in classroom settings also. They are sleek devices, most of them. So the youth gets involved in e-cigarettes with vaping through these marketing tactics, and which basically is almost counterintuitive or contradicts the reduction goals, because as such more number of people who as such cannot go directly to cigarettes, they have started or they are using the e-cigarettes and getting addicted to nicotine. So that is something which is very, very disturbing. So if I have to summarize this, I would say that we need more of independent research, which will definitely highlight for some the need for stricter regulations, more public health education campaigns, and the surveillance, so as to mitigate the harmful effects or potential abuse potential of the e-cigarettes, especially in the youth and non-smokers. Hello.
Hi, Dr. Ravi. Sorry, I got a network glitch, so I have now
Mhm.
joined from the phone. I'm sorry about
Okay.
that.
Okay.
So
No
my
issues. I
network.
hope I was Kunal. Was I audible in
Yes, sir.
between?
Yes, sir. You were audible.
Okay.
Thought I've heard you properly, loud and clear. Thank you, sir.
Okay. Thank you.
Yeah. So sorry, Dr. Ravi. I was in the middle of your answer when the network glitch happened. So I'll connect back to you on that topic once again. But I really had a burning question. The first question that I had is, which I wanted to share with everyone. What exactly does this term harm reduction means? Is it like, they are saying we will harm you, but we'll harm you less? Is it like something like that? No, what exactly is harm reduction?
As this is something which I learned from my mentor and the CEO of this organization, Professor Ravi Mehrotra. It's almost like jumping from fourth floor rather than 10th floor. So this is one example which he cites very often, used to cite very often. So yes, harm reduction as such, they mean to say that the ill effects of conventional cigarettes are more as compared to e-cigarettes. The industry is basically portraying it like this. Therefore, like for example, we usually use Nicotex as or chewing nicotine gums for the harm reduction, or basically I would say to go away from this cigarette dependence or tobacco. So they are trying to portray it like this. However, the main issue is that the amount of nicotine which is being infused through e-cigarettes, that usually is found to be so high in quantity that it leads to its own dependence. And there have been instances, there have been researches which show that there are a lot of other chemicals which are available in e-cigarettes, which are definitely harmful. and thus this e-cigarettes are not something which are less harmful, especially citing the reason that it is being used more often as a new, or I would say a step ladder to actual tobacco consumption for most of the naive or new people. So that is where the point is.
All right, all right. Thank you, thank you. So, in your term, you're trying to say that the industry basically knows that people perceive cigarettes to be as harmful, but they should perceive e-cigarettes to be as less harmful.
Yes. One other thing
Okay,
is cigarettes as
it's
such, they
sorry,
are a
please.
social taboo lately.
Mm-hmm,
They
mm-hmm,
used to be in vogue and fashion in 1960s, 70s, and 80s, even till 90s. But lately, especially after 2007 and 9,
mm-hmm.
cigarette smoking has been actually banned from most of the common areas, public places, and also socially. Also, cigarette smoking is not something which is categorized as fashionable these days, thankfully. But what they are trying to project is that e-cigarettes are the one which are less harmful, and second, they are more fashionable. That is what they are trying to make people perceive.
So these are the tactics that they're
Absolutely.
using it. Absolutely. Okay. Okay. So in my experience, what I have heard from the e-cigarette user youths is that they often say that this is a healthier alternative. They're saying like, "Isse kuch nahi hota." That is the thing that they're. So it's like they know that the cigarettes are bad, but they also perceive that e-cigarettes are not as bad as what cigarettes are, and minus the social taboo as well.
Yes.
All right. So, what all other tactics you can recall from the tobacco industry that they utilize to target the youth, and trying to hook up youth with the e-cigarette products?
One definitely is what we already discussed is harm reduction or less harmful as such. Second, and very important, is that most of the e-cigarettes or most of these uh, such products, basically nicotine products, heat not burn products, they are usually sleek, and some of them are very innovatively designed so as to capture the visibility as such. Second is they are flavored. Quite a lot of good flavors are there in these e-cigarettes. That is one of the primary reasons. FDA in 2021 and 22 published two simultaneous, one after the other, reports, which actually mentioned that there are a wide range of flavors, including fruit, candy, menthol, dessert. All these flavors are there, and that is one of the reasons of that it appeals to young people very soon. So flavoring is another thing. Then other thing is, then there are, as I told you, there are small sleek designs can easily be kept inside bags or even geometry boxes. uh, so these are some of the things. Second is, I would say, I have myself seen and observed this, that in the social media, the usage of this e-cigarettes still is kind of, I would say, it is unchecked, and there are so many social media influencers which are using them on Instagram, TikTok, even YouTube, to promote these products basically. So the companies, e-cigarette companies, basically are using the social media more often as marketing strategy rather than the mainstream media. So that is how they are, and they are also like integrating, especially social media influencers, they are integrating it with music, with celebrity endorsements, so as to make it more appealing to youth. So that is again one of the marketing tactics which they have. And of course, initially, when I would say the e-cigarettes, almost like 10 years back when it started, it used to be pretty expensive. Over a period of time, as for many other things, its price has definitely come down. There are price promotions, there are bulk discounts also, which are available, thankfully not in India, but definitely in the Western world. That also is seen. And other than that, I would say that industry is definitely at almost all the levels, both in India and outside, that is lobbying against regulations. Because as we know, in 2019, there was a total ban on the e-cigarettes by government of India. But still, tobacco industry is basically trying its level hard to actually allow, these e-cigarettes as harm reduction techniques or tools for the to the government basically. These are all the tactics which they are using basically.
All right. Since so much, so many efforts are being taken up by tobacco industry, including social media and everything, and you get online retail marketing, sometimes illegal as well. Do you
Yes.
see this as a failure of the implementation of the PICA ban in 2019?
Not a complete failure, but yes, there is a scope of improvement. I would just try to rephrase it like this. There is definitely, and as with many other factors, there is a scope of improvement. And what we need to have is a total, I would say, cumulative cognitive effort, both a multifaceted approach, I would say, which will include education of the parents, the youth, the teachers at a school level, the policy enforcement definitely, because as we can see that this there are still on social media and some marketplaces the availability of e-cigarettes and such products already there. So we need to have that enforcement of the policy, that definitely should be there, and community engagement also plays a crucial role, especially in preventing youth from initiation and getting into this influence of aggressive marketing by the tobacco industry. So that definitely is there.
All right. So you say that the enforcement can be strengthened in coming time, and it's not a complete failure, but it will just take time for people to realize this. Yes, obviously the government has spent so much while making everyone aware on why tobacco use in public is harmful and it should be banned. Now everybody knows. Now nobody smokes in a public in a public
Absolutely.
place. And maybe a time will come when everybody would be aware about the e-cigarette scenario as well. So that can be a possibility for us. So what exactly do you think, Dr. Ravi? As a layperson, as a budding researcher, as a healthcare professional, or as a parent, the lot that is sitting here with all of us today. So what can we do to play a part in this?
Uh, Again, as I told, there has to have a multi-pronged approach. We can have more and more school-based programs in which, as researchers, we can go and also train the teachers there, the educators, to tell them some evidence-based prevention programs can be there, to tell them about the risks of e-cigarette, and the e-cigarettes as such has cardiovascular as well as respiratory harm. They have long-term health consequences also. So these students as such, or I would say youth, they have to be definitely made aware of these things. Then as parents, uh, so the training and teaching of parents should also be done. The second thing is the parents have to be open and non-judgmental in this. So they need to talk more with their children about the dangers of e-cigarettes and vaping, and that is something which is definitely going to go a long way. Then there has to have, I would say, as a counter marketing, I would say counter marketing campaigns should happen. So from as public health professionals from the government side, there should be more and more counter marketing campaigns which are going to tell to public at large about the ill effects of e-cigarettes. Then we need to have more enforcement of policies and regulations, which will definitely include, I would say, the very first priority should be the regulations regarding the e-cigarette advertising or e-cigarette advertising, especially in the social media, I would say. And because that is something which is a low hanging fruit. And as a matter of fact, I'm not talking of the dark internet. I'm just talking of the things which are already there. So dark internet, government may not be able to, venture into that aspect. But on Instagram, on other social media platforms, Facebook, e-marketplaces, and all these things, definitely there can be a very effectively control can happen. Then we definitely need to have community engagement and of course peer influence. So we need to prepare our students, our youth, who are torch bearers for anti tobacco as well as anti vaping or anti e-cigarettes as such. So such peer education will definitely go a very long way and can be very very effective, because what we have seen, I'm working in a medical college and have seen that peer, I would not say pressure, but peer education is one thing which is kind of a, I would say, a best thing of education which we can have. So addressing the root cause of youth vaping is also something which we need to focus upon, because there are so many mental health issues these days, especially in youth. Every other person has anxiety or depression or stress, which contributes to this youth substance abuse. That substance abuse can include uh, n number of things, including vaping, including alcohol, including tobacco usage. So we need to actually expand access to counseling, as well as mental health resources need to increase, because they are going to definitely reduce first, see to it that the diagnosis basically, and second, to reduce the reliance on nicotine as coping mechanism, because the nicotine is usually used as a coping mechanism in such conditions, in condition of mental health support when they need. So we need to actually prepare the mental health support infrastructure as such. Then we also need to curb the industry influence, because that is something which is again a low hanging fruit and can definitely be tackled.
Well, absolutely, very rightly said, Dr. Ravi Kaushik. And you would know better than anyone else. Being a professor in the Department of Physiology, physiology is taught in the first year, and the youth entering college for the first time, you have a direct contact to them. You're the first person they encounter. So,
I'm
can
warden
you
also.
recall?
It's such a
Oh
bad
my God.
situation in
Can you
hostels.
can you recall some situations like that where you actually helped the person come out of that coping in kind of like a coping mechanism, and understood the situation, and maybe not let the person go into the depressive phase or something like that?
Oh yes, of course. We
You
have
said that peer
at,
education and parent open discussions are important. That is there, but parents come at home. In college time, youth have a different set of mind makeup. You know, teachers and mentors and wardens, absolutely. So all of them have a different perspective on how they see children in that age group. So, what is your experience regarding that?
as overall, I would say mental health infrastructure. Almost all the colleges have counselors. We are fortunate that we have a group of psychologists and psychiatrists who are basically trained in de-addiction and all. And we have associated maids also, Maulana Azad Institute of Dental Sciences, where also they have a very big de-addiction center. So we basically try to identify students, and we are have been pretty successful in this. We have identified students, individuals who are having mental health issues and trying tobacco, e-cigarettes. I don't have, I cannot recollect a direct example of e-cigarettes, but yes, we have seen people or students, I would say, getting into this habit and also coming out of this habit through a support system. That support system definitely include all these what we just discussed. This include mental health professionals, teachers, because teachers also definitely, and teachers as such, I would say, they also set examples. And medical professionals, as you know, at least half of the medical professionals are into one addiction or the other. So that is some, I would say, unfortunate thing which still is there in our country, not in our country, but it's worldwide. So we should set some good examples to the youth and young people, and definitely it ultimately a good infrastructure overall that include peer support, peer education, teacher support, psychologists, psychiatrists support that we have definitely done and got many people, many students out of both alcohol, tobacco, and I would say vaping. So that I have first-hand experience of this.
Sure. Thank you for this answer, Dr. Ravi. One question I got that I got a little deflected when the internet glitch came, but I had that question first in my mind when you were talking about when you said that industry is portraying e-cigarettes as a harm reduction tool, and you said that factfully they're not very wrong. They're rather right. Factfully they're right. So that means uh, I think somewhere e-cigarette has a potential to be used as a smoking cessation tool. Is it like that? Is there some possibility where e-cigarette can be used as a potential smoking cessation tool, just like gums and patches?
See, I would again rephrase it. Right now, almost all the products, vaping products, which are there in the market, their main objective is to make a person addict. That is the objective. What we have seen. None of the vaping tool. I'm sorry, I'm using it a tool because we are discussing on that part. Has been found to deliver the nicotine in one SOS basis. Second, okay, sorry, some new messages coming. I will just open that window. I'll just close it. Huh. None of these vaping products actually have the low concentration of nicotine as such, because the nicotine gum, which we usually see, that is one thing which has been pretty successful, I would say, in de-addiction, simply because it releases very low amount of nicotine, which as such is sufficient to quench the thirst of nicotine receptors in the brain. However, not as such, which will make you dependent. So, if at all, as public health professionals or as some of the researchers, if we see this as a potential or a merit, we need to first of all design a product which is able to deliver the nicotine amounts which are extremely less. And second, there are no additive substances which are basically usually found in Joule or vaping products right now.
But that exactly is my question, Dr. Ravi. Why ban it? Why can't we regulate the content? Why can't we regulate the quantity of nicotine release? Just like the standard we have been using it for traditional cigarettes. In India, traditional cigarettes have a standard of how much nicotine can be used, how much raw tobacco can be incorporated, what should be the size, what should be the filter, minimum filter length. We have standards for traditional cigarettes. Why can't we have a standard for e-cigarettes as well? Why just ban it?
Theoretically, you're right, we can have it. However, we should be pretty much aware of the damage potential which is there of e-cigarettes. So, as we just discussed in last half an hour, e-cigarettes are basically a stepping stone for usage of other tobacco products. So that is the primary motive behind e-cigarettes, which the industry is using right now. So we should be pretty much aware that this is the intention with which the companies are bringing in vaping products. So that is something which we should be aware of before venturing into any other products. But yes, theoretically, if you say there is a possibility that that there can be a direct, I would say, inhalational products which can deliver nicotine and can be used as one of the less harmful alternatives, or I would say one of the de-addiction potential they can have.
Well, and this is going to be my next question, and one of the person has also asked this in the question in the chat box as well. So, has any country approached, something like this, making a possibility of using it as a smoking station? What exactly has been the other different countries' perspective regarding e-cigarettes, and what lessons can be learned from these approaches? Dr. Ravi?
Hello, am I
Yeah.
audible?
Yes, Dr. Ravi. Yes.
Okay.
So, did you get my question,
Ah,
Doctor?
yes. I think it's asked by Dr. Sriram, right? Dr.
Yes,
Sriram
yes,
Swami.
yes. So
I
this
can
this
I
is
can
in
see
continuation of
this. Yes.
what you said, that theoretically we can go with it, and what what different countries think about this.
See, the point is that rather than I'm not aware of any country which has basically talked about directly the harm reduction, but yes, there have been countries which have enacted bans on e-cigarettes. Like for example, India, all of us know that in 2019 there was a prohibition of Electronic Cigarette Act, which came into existence. Then Thailand also there was a ban. If I remember, almost 10 years back, 2015 or 14, there was a ban on it, and which included this imprisonment also. Then Brazil also there was some sort of ban which was there. However, Brazil is one country wherein still there is a lot of problem of e-cigarette as such. Then Australia is basically one thing which is a policy of prescription only as such. So in Australia there are some of the products which are available, which like for example e-cigarette you can purchase, but however on a prescription of a doctor. Otherwise it is illegal for sale. So such a kind of thing is there in Australia. And Japan also had a policy. I think it was withdrawn now. I'm not sure, but we can check it now. But Japan had a policy in 2021. I think it came into picture that this yeah, heated tobacco products, they are as such they can be prescribed and they are legal. So Japan is definitely is one thing, whereas this heated tobacco products and not combustible tobacco products, they are definitely increasing. Then many other countries, like for example, South Korea, European Union, they are trying to impose more tax on it. So there is more tax on the e-cigarettes as compared to other tobacco products. So which is leading to increased price of these. So there are such examples which are there. Some of the countries it is totally legal. Like for example, I think New Zealand it is completely legal. There are lot many addictions which are coming with the e-cigarettes. So some of them are totally. Hold on. Why a physician prescribe e-cigarette? Is it related to tobacco cessation? Yes, Dr. Shriram, you're absolutely right. A physician can prescribe vaping products, actually, heat not burn products, uh, for tobacco cessation primarily. Yes.
Okay, so there are a few countries who in wherein it is used as a possibility of a smoking cessation tool, and
Yes, it
not
is.
being completely not completely regulated. So they are being used independently. That must be the case of few countries, including
Only few
Australia,
countries.
Australia and the European Union.
UK also. I think UK also.
Yes. Well, thank you for that.
So it's a mix and match kind of say. I would say total bans are there in Thailand, Singapore, India. Then stricter regulations are there, and there are only specific conditions in which you have a controlled access. So that is there in this Australia, Japan, and in New Zealand. I think harm reduction method they are using. So for harm reduction, they already are using in New Zealand.
To respond to Dr. Sriram, no, no, not exactly. There cannot be any scope of any benefit. Well, Dr. Sriram, why are some countries still able to prescribe e-cigarettes in tobacco cessation? Because e-cigarettes do have a lack of long-term evidence. That is one big reason. Long-term studies are not there on effects of e-cigarettes. And, that is one aspect which the industry portrays on the authorities. That since you don't have any study, then let us do our job. But yes, thankfully, India has recognized the need of nipping the problem in the bud. And obviously, there's one more issue of normalizing the vaping. The vaping should not be normalized in a manner just like the traditional e-cigarettes. It is a step ladder approach to traditional smoking. So that is what many countries are yet to undertake, and thankfully India has done it as a first step. You wanted to say something, Dr. Ravi?
Yes, I was just basically saying that there are two type of researches which are happening, especially with respect to e-cigarettes right now. One are industry driven, and the other, as I actually initiated my talk on this. So there are some of the researches being conducted, which are in which the money was actually funded through the industry. Those researches categorically has told about harm reduction, and from there this particular thing has basically come up, harm reduction thing. So however, the independent researcher data, which if we see, if we delve into it, there is hardly any direct paper which basically talks of the harm reduction or I would say benefits of using vaping. So we need to be a bit selective on that, whether we can actually rely upon the industry driven researches or no.
Well, it's always a tussle between the industry and the public health significance, and a lot of push and pulls makes the policies. I hope, and I'm thankful that India has gone in the right direction, at least in this aspect. We have another question in the chat box by Kunal. What does independent research say about the long-term health effects of e-cigarette use? That's exactly was my point. That we don't have any long-term effects. You cannot still associate that with cancer or anything like that. But we do have some conclusive evidence on respiratory and cardiovascular effects. Dr. Ravi may throw some light on that.
Yes. Uh, Thank you for Kunal. That's a very important and good question. There are so many effects of e-cigarettes, of nicotine, I would say. This is only of nicotine I am talking of. Because naturally, if we see some amount of nicotine is basically formed inside the body. So it is one thing which can act as a neurotransmitter. However, cardiovascular is one thing, cardiovascular health is one thing which can be definitely be compromised from in medium to long term if you induce or inject or take nicotine by any source inside the body. It is basically has to do with sympathetic nervous system. Sympathetic nervous system is the one which gets activated in case of fight, flight, fright. Whenever you are terrified or in that fight wala mode, at that point of time, your sympathetic nervous system gets activated. What nicotine does is exactly the same. It mimics sympathetic, or it leads to activation of sympathetic nervous system. So you have tachycardia, which is increased heart rate, elevated BP. It is found to do the vasoconstriction. Vasoconstriction, that is, narrowing of blood vessels, spasm of blood vessels, basically. So, along with that, it also has been found to high dose of nicotine or e-cigarettes has been found to do endothelial dysfunction. Endothelial dysfunction, I mean to say, there is a innate characteristic of blood vessels to dilate and constrict according to the need. Now, this constriction happens when there is a need of being a person being terrified. While otherwise, nitric oxide is one, I would say, it's basically NO, nitric oxide. It also gets released from the endothelium. So what nicotine does, high dose of nicotine and some of the other chemicals which are found in e-cigarettes, what they do is they reduce the nitric oxide production in the blood vessels. So it leads to more and more vasoconstriction and leading to risk of atherosclerosis. Atherosclerosis is nothing but buildup of plaque inside the blood vessel, leading to thinning of blood vessels, which exactly is the one which happens in case of heart attack and stroke also. So it also leads to the risk of thrombosis or blood clots. It is also known that e-cigarette aerosols, it contains reactive oxygen species. Now, reactive oxygen species are the one which are they are the active molecules which contain oxygen as such, and they are the one which leads to lot of inflammation, oxidative stress, which are damaging your blood vessels, your heart, other organs also. So that also is basically one important thing which it leads to. In fact, oxygen, some of you, I'm sure, must be aware that oxidative stress is one of the important things which leads to premature aging. So when we age, normally oxidative stress over a period of time increases. But when we used to take more and more of oxidative, reactive oxygen species inside us, the aging process, it accelerates. So a person usually ages fast. So these are some of the issues, I would say, which are researched ones. They are not hypothetical. There are studies on these. So, and recently you might have heard of that the, what do you call it? There was a research, there was some of the findings wherein there was sudden cardiac deaths which were there, and it was found to be linked to the vaping. That, but there was no corroborative evidence that it was only due to vaping or something, but that was an incidental finding maybe. But yes, cardiovascular and along with that some amount of pulmonary, vascular mainly, these risks definitely increases.
Thank you, sir.
Dr. Ravi, since they're already targeting youth, is there any evidence which is, reflective upon that e-cigarettes also affect mental or brain development? Is it like that? Do we have any evidence on that, brain development?
See, it's all about the amount of neurotransmitters in the brain. There are various type of neurotransmitters in the brain which are there. They include basically your acetylcholine, nicotine, adenosine, GABA. Some of them are excitatory, some of them are inhibitory, and some brain-derived neurotropic factor (BDNF). That is one of the important uh, growth factor which leads to more and more synapses. So as every one of you must be aware of that brain cells, they cannot multiply. But what they can do, how our memory increases, is there are more and more connections between these neural cells or neurons. And brain-derived neurotropic factor is known to be one of the factors or growth factors which increases this. So the more we get in that excited Vara phase, that there are less chances of rest of the brain. So only at rest, you must be aware that it is a very widely known fact that while you sleep, your memory consolidation happens. Right? You must have heard about it. That if you need to have a good memory, you need to sleep for a good amount of time. But if you consume more and more of nicotine, what usually happens is that brain is not able to go into that resting phase. Therefore, the memory consolidation, the brain development as such, you can just rephrase it as brain development.
Absolutely.
In medium to long term, that also can be impacted.
Well, yes, maybe the evidence is yet to come, but I think it surely has an impact on the mental and brain development. I'll just ask, Dr. Saab, I'll just ask two more questions and then I'll leave the house for open discussion if anyone wants to ask a question. My two questions are, is there any, apart from this health impact, do we have any environmental impact as well of e-cigarettes? And the other question is, is there really a term on second-hand smoke because of e-cigarettes? Do we have any second-hand smoke or its effect as well based on e-cigarettes? These are my last two questions.
Right. See, e-cigarettes are known to have, there has been so many studies in which it has the e-cigarette aerosols. It is not particularly smoke. So tar is definitely very less or not there. But the aerosol, e-cigarette aerosol does definitely have some of the harmful chemicals, like for example, acetaldehyde, formaldehyde, acrolein, which can definitely go to other people and can harm the lung tissue. That definitely is there. So it definitely is not without any potential of second-hand harm. So it does have, but definitely smaller amount as compared to cigarettes. But definitely it does have some impact. I'm not sure of any such studies, but this JAMA, the Journal of American Medical Association, JAMA, has published a paper on the JAMA studies on e-cigarette, which definitely talks about the aerosols and their potential bad effects on the as a second-hand user.
My second question was about the environmental impact, Doctor.
Again, it would again be related with few things along with these aerosols, the product itself, because most of them are plastic products, and refilling of the liquid,
Battery operated.
yeah, battery operated, so plastic and battery, both of them can be very detrimental to your environment. So going on that perspective, I would say definitely there are some of the potential, not potential, I would say there are real harms which e-cigarettes are definitely doing to the nature.
But are there any studies that have come up with this point yet regarding the environmental claims and regarding the secondhand smoke? Just a question. I'm not very sure about it.
Uh, about the aerosols which I was talking of, there definitely is, as I told you, it's in JAMA. I think 2022 paper is there. But if I have to talk of, I'm not very sure of this. But I'm sure there must be some published literature on that. I'm not very sure of. But theoretically, as we can see, it is definitely a real problem and a problem to come. I'm not sure of any such studies as such.
All right. Also, there has been a term which is used very commonly today. That's vaping cessation. Now, apart from tobacco cessation, we also have a new effort to undertake. That is vaping cessation. That is also in the news these days.
Right. That is in vogue, especially in Western countries, because there have been instances wherein the youth they have got addicted to vaping, and vaping has basically led to their, I would say, did not deteriorated. I would say they are usually in high state of excitement, and that excitement is leading to their decreased performance in varied aspects of life. So that is one of the problem being seen. There have been more instances of anxiety because of this high nicotine levels. So that is something which definitely is coming up in a bigger way in Western countries, but definitely we need to have efforts in this direction in India also.
Well, all right. Well, these are the list of questions from my end. And do we have any queries or any comments or any questions from the participant side? Anyone? Dr. Sriram, Kunal, anyone? Dr. Ravi is here with us for a few more minutes. If you want to ask anything, if you have any doubt about e-cigarettes, you're free to type your questions in the chat box. Oh, okay, we have already been receiving compliments for your session.
So I wanted to ask one thing. As you already mentioned about the aerosols that will lead to the harmful effects to the nature, I just googled the particular keywords, and came to know about a particular term which is VOC,
Which is
volatile organic compounds. Volatile organic compounds.
volatile organic compounds. Yes,
That's
Uh,
a
and
constituent of smoke.
yes.
uh, I wanted to know about that. Does this thing also leads to the harmful effect to the humans or nature? VOC. It is a constituent of aerosol, I guess, as per my research.
Haha, VOCs, yes. See, it basically VOC is nothing but the, like for example, aerosols I was just talking of. It is just the renaming of these aerosols only, which definitely have some risk. As I already told that, for example, formaldehyde, aldehyde, they are cancer-causing elements. They are cancer-causing chemicals. So definitely, if you see, they have potential to increase the risk for cardiovascular diseases, for cancer, for respiratory diseases. So although e-cigarette do not have tar, but they definitely have these volatile organic compounds, or VOC, as you say, and there are so many of them which are there. Benzene is
If
there,
I
toluene
if
is there, xylene is
if
there, along with
if I may
formaldehyde,
add on
acetaldehyde.
to Dr. Ravi's response, basically the volatility of these compounds is added by the chemicals which have a benzene ring in it, and benzene is extremely toxic to human body. So any compound that has a benzene ring or a pyrroline ring, like a five carbon ring, so that is going to be extremely toxic to the human body, and it is basically a constituent of smoke, and it makes the ash and makes the all the products, the byproducts go into atmosphere as a volatile compound. So these are like the naturally occurring substance which makes everything go into the smoke after burning. But
Uh,
yes, they are
Not
extremely
even
harmful.
burning, even in heat not burn products also they are seen.
Absolutely,
Yeah.
absolutely. Thank you. Uh, we have a question from
Evidence
Sabina.
of effect of e-cigarettes on cancer production?
Hello, ma'am. Good afternoon.
I'm
Aruna
ask,
ma'am is here from Indian Cancer
I,
Society. Hello, ma'am.
I'm asking, is there any evidence of its impact on cancer causing effect?
Ma'am, as such, if we see these chemicals which VOCs we are talking of, they definitely have cancer potential.
No,
Uh,
no, ma'am is talking about e-cigarettes.
Yeah,
that is
because
what.
is a part of it. Yeah, yeah.
So e-cigarette definitely, you know, releases all these VOCs. So e-cigarette definitely are toxic as such, and can cause cancer. And there are some of these studies, if you see, which I'm not very sure of. I'm not remembering the name of these studies as such, but I think there was one review article in which I would just see and share with Dr. Shekhar, and he'll just share it across with you. But I remember seeing some of the one or two of such studies wherein there was. It is actually not a public health one. It is more of a, I would say, a lab-based study which was there, in which it was seen that DNA damage is definitely caused by the vapors of e-cigarette. So if DNA damage is caused by vapors of e-cigarette, anything which is damaging DNA will have a cancer-causing potential. So such studies are definitely there. Public health study, I'm not sure. Public health study, I really don't know whether there is a public health study as such which shows a direct correlation. But laboratory studies are definitely there. I'll just search and share across.
Thank you.
Ma'am, there are a few retrospective studies among cancer patients, and they have been explored to using whether they were using e-cigarettes or not. And the evidence so far has been inconclusive. There are a few retrospective, but again, cancer patients they have a lot of factors of the determinants of developing cancer, not just one e-cigarette. So exclusive e-cigarette study, as Dr. Ravi rightly said, it's not there, and he has mentioned about a few lab studies and others as well.
So
Thank
this
you.
lab study was there in which mice was exposed to e-cigarette aerosol, and it caused some DNA damage in the mice. It was a 2018 study. I'll just share the reference.
All right. Thank you. And yes, we have another question. Sabina has asked, sir, why it is still not banned in a few places, though it is found to be dangerous. I think she meant by places, she meant countries, I think.
Yeah, right. Again, we know that there is a there's a bigger sibling, tobacco, directly cigarettes. They also are not banned. uh, More than 10 varieties of cancers are caused, or even more, are caused by alcohol. Even that is not banned. So, and that is something, as public health professionals, we definitely see as challenge. But industry as such, if you see, there are strongholds in industry which are which have basically decision taking capabilities with respect to government level also, regulatory level also. So it is something which is, I would say, beyond our purview. But what, as public health professionals, it is our moral duty to work for, I would say, our society, and make them aware about the ill effects of such things, and ensure that less and less people are following it, and also collectively make continued pressure on the regulatory to, if possible, to complete ban in almost all the countries, which in India, thankfully, already is there, and also see to it that illegitimately also the people are not able to get it. That again is one of the issues, especially in India, I would say.
Sabina has asked one more question. When we compare with tobacco, which is more dangerous? And I think Dr. Ravi initially had remarked about that. If we fall from the ninth floor or if we fall from the fourth floor, which one is dangerous? Well, in fact, both are dangerous. In both cases, one is going to die horribly. So you cannot compare the dangerousness of these two products. Exactly. We have one question. We have one query. So can you please, from Abhishek, so can you please share about some highlights or comments about EBD, which is a new shift in youth from e-cigarette? I'm not sure
Ah.
if anything like that exists.
EBD is actually kind of a e-cigarette only, wherein it is packed in a more organic way. So EBD is basically, it's a new thing which has only few reports have seen, wherein they're packaging the similar product in less of plastic and plastic product. It's more of some organic material is basically there in between the plastic body and the nicotine, this liquid which is there. I'm not very much aware of other than that about the EBD. If Dr. Shekhar or anyone from the group can highlight on this. I just heard
No,
about about
never
it
heard
once or
about
twice only.
EBD. Maybe Dr.
I
Abhishek
did hear
can.
about it once.
Okay. Also, there is something like this.
Yes, yes, it is.
Okay. Now, all I have heard about is the herbal BDs that are coming up. I've not heard about the electronic version of BDs anymore. Anyways, there are a lot of things that comes up on a daily basis, and we
It's
need to be
actually the
aware
kind
about it.
of, most likely it is a kind of e-cigarette only, just being rephrased by some company, maybe. I'm not sure.
All right, all right. So, do we have any further questions? Anyone? Anyone? We already 4 minutes ahead of schedule. So I guess this is it, and we have had a very beautiful and a very thought-provoking interaction with Dr. Ravi Kaushik, and we really thank him for sharing his expertise with us, and especially about the youth when you talked about how you interact with them daily and how important it is to condition them as per the changing world, as per the changing environment. It is very important for us as parents, as peers, as someone who is responsible for making the society a model society. So it's very important for us to curb this habit and make sure everything around everyone around us remains happy and healthy. So, thank you so much, Dr. Ravi, for this insightful talk. And we have learned so much from you today. Thank you so much. And in case there is any further query, I'll be sure to email you. And we have shared your email with the participants as well, in case they want to ask you something.
Sure.
So thank you so much again,
Thank you
Dr.
so
Ravi, for your
much.
time.
The privilege was all mine. Thank you so much.
Thank you so much, sir. And thank you, dear participants, for making this session very enthusiastic. All right, so I'll end the session now. Thank you very much. Have a good evening.
Thank you.
Bye-bye.
Take care. Bye.
Bye-bye. Thank you.